All right, so we are going to be performing a Foley catheter on Mr. Fundamental Sphere. I checked my provider order and it is correct. I verified my patient, I introduced myself, I performed hand hygiene while entering his room, and I provided him privacy. So we are performing, we're going to be inserting a Foley catheter to Mr. Fundamental here because he has been unable to void post-op, and he has some bladder distension. There's about 150 cc's from the bladder scan. And so I'm going to educate him on the insertion of a Foley catheter and why we are doing it. So 3 reasons are enlarged prostate, bladder retention, and surgery. And then 1 risk factor is possible infection, but we will ensure that we teach him how to take care of his catheter so that we do not run that risk. All right, so I raised my bed to the appropriate height. I have a sanitized workstation with my sterile kit, my hand hygiene here, and this pair of gloves is I'm going to provide pericare to his area, which I will do with this pair of gloves, and I will throw away. Okay, so I have my sterile workstation here, and I have my sterile kit, and I am performing hand hygiene. All right, so I lowered this bed rail for it to be moved out of my way, and I raised everything to the appropriate height. And so now I am going to uncover Mr. Fundamentals. Okay, I'm gonna perform hand hygiene again since I touched him. Okay, so I'm going to unpack my sterile package. I'm going to discard of that outside, and I'm going to keep an eye and only touch my corners of this. And right on top are my sterile gloves. Please get out of the way. I can get my hand in there, that'd be really swell. Okay, sterile gloves are on. I'm going to remove this. All right, and I'm going to open this up without taking my eyes off my sterile field. Place that down. Okay. All right, and then this is a complimentary drape, which I will not be using, but if I were, I would place it around his genitalia. And then iodine wipes, which we will not be using. I have my lubricant, I have my swabs, and I have my saline, which I am going to connect here. Okay, now I'm going to clean this area. So I'm going to do and toss. I'm going to be tossing this fully clean around the area and down the middle. All right, okay, I am going to grab lubricant and spray the area, which is from my sterile packaging. Yeah, that looks good. Going to coil this around my finger. probably take this packaging off. That did not fall out of nothing. Okay, I'm gonna bring this over to my clean field, and I'm going to grab with my left hand and insert. I am twisted. Okay, here we go. And then
you see urine?
I see urine, and then you go in another 2 inches. And then I'm going to hold this with this hand and then insert or inflate my balloon. Oh, it's inflated. All right, detach, discard, and then I'm going to clip this to his leg and hang my bag below bladder level. All right, it's hung. All right, and I am going to clean up my space since I am no longer sterile. And I'm going to provide him with some privacy, and then I'm going to educate him on proper catheter care and how it's gonna go. All right, that's it. I'm gonna take these off for hand hygiene.